Abnormal Psychology, Lesson 3. Today we are looking at mood disorders. Mood disorders. And this is your host, Dr. Tulipo Mwenfumbo. We have got varieties of programs that we offer, starting from business courses, short and long-term programs. So we offer varieties of programs, and you are welcome to register in any of our programs. We have diplomas, we have got certificates, and we have got degree programs. So you are welcome. The other thing is that we have got a lot of books on stock, which you can order to help you, and as uh, as you go on in life, and also as a student. So there are varieties of programs, there are the varieties of books that I have written. I've written a lot of books, and you can get books in psychology, you can get books in business, you can get my books in law. So you are welcome. You can find these books by just commenting uh, on the comment section. You can say you can call me, or you can WhatsApp me on +260 976 18 12 53 +260 976 18 12 53. Our programs are online, 100% online. You write the exams online, you do everything online. Welcome back. So you can order for this course, you can order abnormal psychology. This is the course which we are doing. And today we are looking at specifically, we are looking at mood abnormality, what creates mood. So here I'm just giving the brief, and you can find more information on this book. So you can order the book, and we'll be able to deliver to you. We have both in soft copy and hard copy. So when we talk about mood disorders, in this lesson 3, we are going to give the definition and symptoms of mood disorders. We are going to look at causes and risk factors for mood disorders, and we are going to look at treatment options for mood disorders. What are mood disorders? So when we talk about mood disorders, this is a group of mental health conditions characterized by persistent changes in mood that affects an individual's thoughts, feelings, and behaviors. So you have seen there are in this there are categories which are defined in the book, but we are just going to look at general symptoms or general mood disorders. So these are conditions that are characterized by mood changes in an individual. So you'd find that today this person is in this mood, the other day is in this mood, and they keep on changing. What are the symptoms of this abnormality? So the symptoms of this abnormality is depressive symptoms. So people that have got challenges in mood, or they have got what is called the mental illness of mood disorder, they most of the time they have got symptoms of uh, depression, which they feelings of sadness. You may find that today this person has just woke up very sad, Yes, sometimes it is normal, but there is the excessive, whereby a person just becomes sad, helplessness, loss of interest in activities. Find that this person doesn't want to do anything, is just frustrated, discouraged for over nothing. So this is a symptoms or a symptom of mood disorder. Then there is also what is called manic symptoms, which is feelings of irritability and increased energy. Sometimes people that have got this mental disorder, you find that they become irritable easily. Sometimes we may just find that they're irritated over nothing. So that can be the mood disorder. You may be speaking something else. You find that they they react. They're irritated over even small things. A child has not done anything. You may find that they shout at the child. So that is one of the things that this uh, mental illness can be able to do. Then we have got mood swings, rapid changes in mood from depression to mania or vice versa. You may find that a person is just irritated. Sometimes they just go quiet. They are depressed. So this is a disorder that needs to be worked on. Then there is also changes in appetite or sleep. So it also creates one to lose appetite, and others they become just so there is just an increase in appetite, and or sometimes a person will just sleep abnormally, and other times they will just stay awake. So it changes the moods in sleeping. So the mood will just swing and change their challenges in those. There is no predictability on how this person is going to respond to certain things. Then they experience fatigue and loss of energy. Sometimes they will just feel weak, and you just fatigue. Sometimes it is a normal, maybe you have worked hard, but to them it just comes in at any time. It feels like coming in, feeling tired or having low energy. Then difficulty in concentrating, trouble in focusing or making decisions. So people that have got mood disorders, they face challenges in concentrating, even to make decision, even simple issues, they fail to make decision. Now, what are the causes and risk factors of mood disorders? When we look at the causes can come from genetics. Sometimes it's just a family challenge. Family history of mood disorders can increase the risk. So somebody who has you have got maybe your aunt, your uncle, your father, your mother who have had this challenge, you may find that you are at risk also of having such a mental disorder. Then the other thing is that sometimes it's brain chemistry, imbalance of neurotransmitters, uh, neurotransmitters, whereby you find that there is a gap in your neurons, and there are what is called there are biological challenges within your body that creates that. So that is can be the cause. Then there is hormonal changes, changes in hormonal levels such as during pregnancy and menopause. You have seen that there are people that become so mood when they are pregnant, or they are having peace, and so that also creates the mental disorders. I met this lady. Whenever she's pregnant, she'll go mad, literally mad. So there are changes in hormonal, which may cause some disorders. And here we are talking about mood disorders. Become irritated, become someone becomes so disturbed, they go quiet, they fall to sleep, all those swing in their mood. Then other times, life events, significant life events such as trauma or stress, they may cause also mood disorders because of what you go through, or because of what you have experienced. Maybe you have experienced mistreatment, and all that may also cause mood disorders. Most of these mental health, they have got a triple way of coming. They may be biological, they may be psychological, they may be heritage. So those are the major words that mental illness come from. Now, what are the risk factors? The risk factors, we are talking about family history, having a first degree relative with mood disorders. And that can cause also some people to have mood disorders because of heritage. They have just inherited this kind of mood, life of mood. Trauma, experiencing traumatic events, stress, ongoing stress, or significant life changes. Then others, it's because of substance abuse, whereby you are drinking so much, or alcohol can cause this, can damage the function of your neural system, and also the brain functions, and creates what is called uh, mood disorders. So having using substances like drugs and alcohol can also create or bring this challenge of mood disorder. Then there is medical conditions, certain medical conditions such as thyroid, thyroid or disorders, or chronic pain, whereby somebody goes into a certain pain, and or become sick for sometimes. The hormonal system or the neural system changes, and there is disorder in the neural system, and because of that they develop disorders in their functioning. And that's now, what treatment can be used in dealing with this disorder, this mental illness? So, treatment options for mood disorders. There is what is called psychotherapy, that is through counseling. So, in psychotherapy, we have got cognitive behavioral theory that helps individuals change negative thought patterns and behaviors. So, using the cognitive behavioral therapy, that's where now you use the counseling session, so that this person may be able to, you'll be able to trigger the mind and focus on how this person can be helped. Then there is interpersonal therapy, which helps individuals improve relationships, whereby you help this person through what is called interpersonal therapy. When we talk about interpersonal therapy, it is also a session that you may be having with this person, triggering the mood, whereby you, the mind, you are tuning your mind so that it becomes stable when it comes to relationship, and it comes to disorders, mental disorder, which is mood. Then there is family therapy that helps individuals and their families cope with mood disorders. That is where people should understand somebody who is having these challenges, and also to move according to the way this person is moving. If he's quiet, you just know how to treat him in his mood. Then there is medication, there is antidepressants. So the antidepressants also helps these types of moods. Depressants, that medications that can help reduce depressive symptoms. So there are different depressants that are given to regulate or to relieve the brain nerves, so that the tension in the brain and or in the body system, they are regulated. Then there is mood stabilizers. There is also the medications that can help stabilize mood. Then there is also psychotics, psychotic medication, which this medication that can help reduce monarchy symptoms. So um, you can get the hearing, or you can help somebody by referring this person to the physician or to the psychiatric, who can be able to deal with this by applying the medicine. Now, as a psychologist, your major duty is to help them psychologically by giving them counseling and guiding on the therapy that can be used. Lifestyle changes. So also you can help a person to do regular exercises. Exercising can help reduce symptoms and mood disorders. Where because when the one is doing the exercises, there is the blood flow, and that makes that person to regulate the hormones in the body and also the neural system. And then there is also sleep hygiene, establishing a consistent sleep schedule and creating a relaxing sleep environment. So you sometimes just tell a person or help a person to develop what is called sleep uh, hygiene, where this person has to uh, make a regular sleeping habit. For example, if this person can develop the habit of sleeping maybe 8 hours, when they are waking up, they wake up fresh and in a certain mood. Then there is healthy diet. Eating a healthy diet rich in fruits, vegetables, and whole grains. So this can also help in this mood disorder, just eating habits. There are also alternative therapies like mindfulness based on therapies that is focusing on the present. Sometimes what creates the mood disorder, it is because of worrying about the future. One is so much caring about tomorrow, but focusing on today and what is important on that particular day can also help one to relax and also to live a life which is a life of happiness. Moods may come because of somebody is worrying about the future. Then there are herbal supplements. Certain herbal supplements can also help in moods or regulate moods. Then there is light therapy, exposure to light, and also the when you look at the light therapy, you have seen the like in the disco houses or in nightclubs, there are those lights whereby when they are changing, you even begins to change the mood. So there is what is called light therapy. So as a psychologist, maybe you may have created an environment where there are different lights, and when the lights are changing, a person is changing. So there are certain things that changes the mood, which I want us to know. Number one, the light, um, noise, and also temperature. Temperature, these three things, they have got much influence on the mood of a person. I say light, heat, or which is temperature, and also noise. So they may have a certain um, the certain influence on the behavior of a person. So light therapy, that's where now you expose a person to certain light, and a person is going to have a certain mood. For example, if somebody is just goes in the dark room, how is that person behave in the dark room? You may find that they may be quiet and they may start thinking, or if that person may just be in the red light, you will find that they'll start behaving in a certain way. So there is that also which we use in psychotherapy, or in psychologists, where you are able to use the light as a therapy. Let us not forget also the other alternative, which is the prayers and spiritual guidance. So, whereby a person needs some prayers, needs some spiritual help, pastoral counseling, and also deliverance. That is also an alternative therapy. So, as a psychologist, you have to look into all these. So, when you diagnose this kind of uh, illness, you need to know which therapy can be able to work. We say there you have to diagnose the sources of this therapy. It may be demonic, it may be brain damage, which is biological, it may be maybe this person has gone through certain challenges or trauma. So you have to know which therapy may be necessary as you giving psychological therapy as a counselor. In conclusion, we are saying that mood disorders are complex mental health conditions that requires comprehensive treatment. So when we talk about treatment, we have talked about medical treatment with the psychotherapy. We have talked about spiritual treatment and deliverance. We have also talked about other alternative treatments, which may be light or using other herbal medicine. Understanding the definition of symptoms, causes, and risks can help individuals seek effective treatment options, including psychotherapy, medication, lifestyle change, and alternative therapies. So, mood disorder is a complex which may reduce somebody to be active, even reduce somebody's energy, and it can cause this person to become not to stop working hard, or failing to work because of disorders. You know, one needs to work whether you are in the mood or you are not in the mood. And there are sometimes people, those people that have are working in public, and if you are you have got this kind of disease or this kind of illness, you may find that it may be a challenge, and in some workplaces, maybe you're a receptionist, you'll be fired. So to have more information on this subject, you should order my book, which is Abnormal Psychology. So order this book, and you'll find most of the information that have been left in this lesson. Thank you so much, and God bless you. Let's meet in the next class.